Ziagen, also known as abacavir, is a medication used in combination with other HIV medications to help control HIV infection. By reducing the amount of HIV in your body, Ziagen allows your immune system to function better, lowering the risk of HIV complications and improving your overall quality of life. It's important to note that Ziagen is not a cure for HIV infection. To minimize the risk of spreading HIV to others, it's crucial to take all HIV medications exactly as prescribed by your doctor. Additionally, using effective barrier methods during sexual activity and avoiding sharing personal items that may have come into contact with blood or other body fluids is essential. Consult your doctor or pharmacist for more information on the benefits, daily dosage, and optimal timing for taking Ziagen. Before you start taking Ziagen, be sure to read the medication guide and warning card provided by your pharmacist. It's important to carry the warning card with you at all times. If you have any questions, ask your doctor or pharmacist. Take Ziagen by mouth with or without food as directed by your doctor, usually 1 or 2 times daily. If you are using the liquid form, be sure to measure the dose using a special measuring device or spoon. Don't use a household spoon because you may not get the correct dose. The dosage of Ziagen is based on your medical condition and response to treatment. For children, the dosage is also based on weight. If you stop using Ziagen and then restart the drug, you have an increased chance of developing a very serious allergic reaction. Therefore, it's important to refill your medication before you run out and not to stop treatment unless directed by your doctor. Before restarting Ziagen, consult your doctor or pharmacist and make sure you have easy access to medical care. It's crucial to continue taking Ziagen exactly as prescribed by your doctor. Do not skip any doses, increase your dose, take the drug more often than prescribed, or stop taking it even for a short time unless directed to do so by your doctor. Skipping or changing your dose without approval from your doctor may cause the virus to increase, make the infection more difficult to treat, or worsen side effects. For the best effect, take Ziagen at evenly spaced times. To help you remember, take this medication at the same times every day. If you experience trouble sleeping or loss of appetite, it's important to notify your doctor or pharmacist. This medication has been prescribed because the benefit to you is greater than the risk of side effects. As your immune system gets stronger, it may begin to fight off infections you already had, possibly causing disease symptoms to come back. Get medical help right away if you experience serious symptoms such as unexplained weight loss, severe tiredness, muscle aches/weakness, headaches, joint pain, numbness/tingling, vision changes, signs of infection, signs of an overactive thyroid, or signs of a certain nerve problem known as Guillain-Barré syndrome. It's also important to notify your doctor if you experience mental/mood changes such as depression or anxiety. Rarely, this medication has caused severe liver problems and a buildup of lactic acid in the blood. Women and obese patients may be more at risk for these serious side effects. Get medical help right away if you experience symptoms of liver problems or lactic acidosis. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you experience any serious side effects, be sure to inform your doctor right away. Ziagen, also known as abacavir, can sometimes cause a serious allergic reaction in certain patients. Before starting or taking this medication again, your doctor will order a blood test to measure your risk. If the test shows you are at greater risk, you should not take Ziagen and discuss other treatment options with your doctor. Symptoms of an allergic reaction may include rash, itching, swelling, severe dizziness, trouble breathing, fever, extreme tiredness, nausea, vomiting, diarrhea, stomach pain, muscle aches, sore throat, or cough. If you experience any of these symptoms, seek medical help immediately. If you have stopped taking Ziagen due to an allergic reaction, you should never take it again, as it could be life-threatening. Be sure to inform all your doctors and pharmacists if you have stopped taking Ziagen due to an allergic reaction, and properly dispose of any unused medication. For more details, read the warning card provided with this medication. Before taking Ziagen, it's important to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Before using Ziagen, it's important to inform your doctor or pharmacist about your medical history, especially if you have liver problems, kidney problems, or if you consume alcohol. It's important to note that Ziagen may increase your risk of a heart attack. Be sure to discuss the risks and benefits of treatment with your doctor, and ways to lower your risk of heart disease. It's also important to let your doctor know if you have heart problems, if you smoke, or if you have other conditions that increase your risk of heart disease such as high blood pressure, diabetes, or high cholesterol levels. Before undergoing surgery, be sure to inform your doctors or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the risks and benefits of using Ziagen with your doctor, as treatment can lower the risk of passing HIV infection to your baby. It's also important to note that this medication passes into breast milk, and because breast milk may transmit HIV, it's important to consult your doctor before breastfeeding. When taking Ziagen, it's important to be aware of any potential drug interactions that could affect how this medication works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ziagen include alcohol, methadone, or Orlistat. It's important to avoid taking this medication with other medications that contain abacavir. Check the labels on all your other prescription medications to ensure they do not contain abacavir. If you have any questions, consult your doctor or pharmacist. As for the daily dosage, it is typically recommended to take Ziagen twice a day, with or without food. It's best to take the medication at the same times each day to maintain a consistent level in your body. Remember to follow your doctor's instructions and guidance on the best time to take this medication for your specific needs. If someone has taken too much Ziagen and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important not to share Ziagen with others. Your doctor may also require you to undergo lab and/or medical tests, such as liver function, viral load, and T-cell counts, while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose of Ziagen, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and continue with your regular dosing schedule. It's important not to take a double dose to make up for the missed one. Stick to your regular dosing routine. When it comes to storing Ziagen, it's important to keep it at room temperature, away from light and moisture. If you have the solution form, you can also store it in the refrigerator, but make sure not to freeze it. Keep in mind that the solution may change color over time, so it's normal for it to go from clear or yellow to brown. Remember to keep all medications out of reach of children and pets, and don't store them in the bathroom. When it comes to disposing of Ziagen, don't flush it down the toilet or pour it into a drain unless you're specifically instructed to do so. Instead, properly discard the product when it expires or when you no longer need it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. As always, it's important to follow these guidelines to ensure the safe and proper use of Ziagen. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.